This program is made possible in part by Cerisi Conlon LLP, protecting the future and using the law as a force for good in both the courtroom and our communities. Online at cerisiconlon.com.
Hello and welcome. Well, I'm with Jen Malcolm tonight, and I am guessing that most of you feel you know her because she's been our voice of calm, as I think of her, in these last few years with the pandemic. Jen is the state of Minnesota's Commissioner of Health. She comes from a long line of health-related other career options and jobs. And so we're going to talk tonight about her role as a leader in the field of health, but I'm also full of questions and want to spend a hunk of the time asking her some of our questions, yours and mine, about COVID today. We are taping, I want to mention, October 25th, 2022. So we're not going to date anything. You tell us, Jen. Welcome.
Thank you, Mary. It's nice to see you.
Yes, it's great to be with you again. We were reminiscing. It's been years and years since we were together on the set. Well, as Commissioner of Health, I read you had 1,400 people working in this department.
Normally we do. With all the COVID activity, we almost doubled in size over the last couple of years.
Goodness.
With all the federal funding that we were managing and during the height of the pandemic. So we're much bigger temporarily because of the pandemic.
Oh my goodness. And the duties that fall in the focus that fall under your umbrella: cancer control, food safety, health equity, infectious diseases, of course. How many different sections do you have any idea on that?
Well, a lot. I mean, that's one of the great things about public health is, as you said, just the breadth of the issues that we are privileged to work on to try to keep Minnesotans healthier. So what we're probably most known for is infectious disease, tracking and finding and usually stopping outbreaks before they become quite such a disruptive force as COVID-19 has been for the whole globe, of course. But we're very, very well known for our work in infectious disease. We also have one of the best public health laboratories in the whole nation.
That I did not know.
Yeah, we're really doing some cutting edge work on all kinds of different kind of genotyping, knowing which variant of the virus we've got. They also do a lot of work in environmental health. So we do span a great number of areas: maternal and child health, chronic diseases of all kinds. We have about 20 different divisions within the department, and each of those have multiple sections. So for infectious disease, for example, there would be vaccine-preventable diseases, or foodborne diseases, or zoonotic diseases, which are diseases originating in other species. Emerging infections. So that's just an example in one division that has 4 or 5 different sections, and that's pretty much true of everything in the department. Folks get quite specialized in their areas of expertise.
How do you sort of mentally and emotionally handle having that many things going on under your leadership? That
Well, it's never a dull day. The issues
sure.
are fascinating, and they're so different, and they're all really, really important. So it's really quite an honor. There are times when it's a little overwhelming, just the sheer size of the responsibilities of the department. I just have the privilege of leading some incredibly wonderful professionals who are so dedicated to public service and to health that they're the ones who do the real work. I'm just their cheerleader.
Well, you must not have trouble delegating, I'm guessing.
I've learned how to
learned
do
the
that.
hard
Yes,
way?
absolutely. And it's easier when you have really, really talented people, obviously.
We were talking before the show started, and Jen told me that as a young girl, she had decided she wanted to work in the field of health. How young were you at this?
Well, I was set on being a doctor, and that came from a very early age. You know, I had some minor health issues as a child, and was just fascinated with the whole thing. So I just declared I was going to be a doctor. And back then, not too many young girls had their sights set on that, and people would say, "Oh, do you mean a nurse?" And then it became
Did they really?
an issue. You know, so it was like, no, a doctor. So.
We're back.
Exactly. So that was kind of what I was pursuing. I did a pre-medical curriculum at where I went to college, which was Dartmouth. But then in my last year of studying to pre-med before applying to medical schools, I was able to take some courses in health policy. Like, why is the system the way it is? And I really got fascinated with that. So I started to work in the field of health policy, always thinking I'd go back to medical school at some point. Never got around to that, but I was fortunate to find something that I've been so passionate about.
That is fortunate, and probably fortunate that it happened when it did, saving you maybe some years of med school that you might have had to let go if you discovered later that you liked the policy part. You've worked in a lot of leadership, as I was saying, roles here in our state. Just give us some of the main ones in terms of time.
Sure. Well, right out of college, I had the chance to work at a health policy research firm here in Minnesota called Interstudy, led by a somewhat famous person named Dr. Paul Elwood, who was a very leading health policy person at the national level. So that was my kind of graduate school equivalent, I always say. It was just
very cool, wasn't it?
Very much, yeah.
Job.
As a young person, getting to run around the halls of Congress, you know, writing speeches for senators and the like. So that was my first health policy experience. And then I went to work for some of our great healthcare organizations here. I worked for Park Nicollet Medical Center. They had a health plan called Med Center's Health Plan. I worked at Group Health, then Alina, and then had the opportunity to be the commissioner of the health department when I was much younger under Governor Ventura.
Years were those,
Yeah,
Jen?
so Governor Ventura was elected in 1998, so I served with him his whole term. So from the very beginning of 1999 to the beginning of 2003. Those were my first years at the health department.
I'm guessing this is not a common thing, that one becomes commissioner and then again becomes commissioner.
I think it is rather unusual. Yeah, as far as I know, I'm the only person that's worked for 3 different governors over the span of 20 years. You know, a lot of people remain in the job for a more continuous period of time, but to come back after a long time away was really interesting.
Right. And the
Many
third
things
governor
had not.
was?
It was Governor Ventura. Then I came back for Governor Dayton's last year in office, and then
As commissioner at that point too. Oh,
and
I'd
then
forgotten
stayed
that.
on with Governor Walz.
Okay, yes, that is rare. I'm guessing
Yeah.
really a rare story. Your folks, were they in health kind
No.
of related work at all?
No, they weren't. I'm a Minnesota girl. Grew up mostly in Bloomington, and then also in Minnetonka for my high school years. And my dad was a sporting goods salesman, and my mom was a professional model, and then a realtor. So they were both working, but not in this field.
Did they live? Are they still alive and have seen you in this leadership role?
Well, they got to see me in many of those roles. Unfortunately, my dad died 3 years ago, my mom 2 years ago. They both lived long lives, but lost them both in recent years.
So you've had a lot of losses in the last 3 years, haven't you?
I have.
I was asking Jan a personal question because I had read that her spouse had died right, I believe in January before COVID kind of hit us. And I thought of you often during all the days and months and years that you had to get in front of all of us and give us bad news a lot of the time, and still having to deal with your own processing of your partner's death. And how did you kind of do that? What did you do that got you through that?
You know, in some ways, it certainly gave me a purpose and it forced me
a reason to get up in the morning.
It forced me to just keep going. Not that that was entirely healthy. I mean, I still have a lot of grief to process. It's been a pretty stress-filled, overly busy last few years, and you know, and being alone during that time's been very difficult. But my partner had a lot of strength, and she occasionally is on my shoulder talking to me and telling me to keep on going, as is my mom. So I've got angels on both shoulders, I think. Yeah.
Oh, yes. As I said, I really saw you as a voice of calm. And of course, Governor Walz, I felt that way also about him. What are you thinking right now in terms of the COVID fatigue that I think has hit our country, probably the world? What runs through your mind as you see the kind of nonchalance almost?
Yeah, it's a real worry, and certainly it's understandable that everyone is fatigued by COVID and just wants it to be in the rearview mirror, but it's really not. The virus is still very present, it's evolving very quickly, and it's really still a danger. And but the good news is we have got the tools to manage it, but only if we use the tools. And I am a little concerned that people just aren't thinking about it as much anymore. I don't think people are aware of how much virus is still out there. We still have 400, close to 500 today, people in the hospital every day with COVID. That's a lot of people who are seriously ill every day.
Now that's in Minnesota.
In Minnesota.
And that, multiply that times, I mean, just roughly 50. That's a lot of people with one disease that
are sick enough to be in the hospital. And these days, with the with the vaccines that we have and the treatments that we have, people who are going into the hospital, have a pretty serious illness. So we are better able to handle COVID, but it sure would be good if we were all still mindful of the fact that even though for many of us it's not as big a risk now that we have vaccines, a lot of people are still very vulnerable to getting very sick. So being aware of how we impact our neighbors, our families, is just important, especially as we head into the winter, when typically there's a lot more viruses circulating. So
with flu also, as
absolutely. If I could just ask Minnesotans one more time to stay current with your vaccines, it makes such a difference in keeping illnesses from being more severe, keeping people out of the hospital and protecting them.
Now, to clarify, most of the people in the hospital nowadays are the elderly, am I right?
Correct. The elderly or people with a lot of underlying health conditions for whom the virus is just that much more dangerous. Also, even though a lot of us got the vaccines right away, not as many of us have kept up to date with the boosters. I understand that too. People are tired of getting shots. But the thing about this virus is that each time it mutates, it gets a little better at getting around the immunity, whether that's from an infection you had before or a shot. If you had the shot a while ago, I just had COVID myself in early September. I had my last booster in May, so my immunity was pretty well worn off by that time.
I believe they've said about 5 months you better get another booster, right?
4 or 5, so I'll be getting the new booster just as soon as I can. It's recommended that you wait about 3 months after you've been infected.
You have to wait then.
Yeah.
I bet you're anxious
I
to
am anxious
get that
to get
shot.
It. Yes.
I read that only 4%, when we look nationally, of the population in our country has gotten the new booster.
Right.
What about in Minnesota, Jen?
Well, the good news is we're better than the national average. We're about twice as good as the country as a whole, but that's still only 8% of the people who yet have the booster. And that when I say we've got the tools to manage it, but we have to use the tools. That's a good part of what I mean. Staying up to date with the vaccine is just so incredibly important to people's, and I think it's been confusing for folks because they know people who had the booster and they still got infected.
And that's been an excuse then,
yeah,
or
and so
a
then
reason.
people think, right, well then it doesn't work. That's not entirely the purpose of vaccines. It's to reduce the severity. It also helps to reduce the spread, the transmission, but the real importance is reducing the severity of the disease and keeping people out of the hospital. So in Minnesota, we've done a great job, particularly with our elders, people over 65.
Right, they're
93%
doing well.
of all the people over 65 had their complete series.
Really?
However,
It's
only
that high.
30% of even that group has had the new booster. So that's a lot of people who are, even though they've done everything right up to this point, have some vulnerability now.
Yes.
And it would be really, really good for everyone over 65, really anyone who's eligible to get that booster.
And there's no carrot or there's no kick in the rear to get people nowadays. Is there much that we can, I mean, other than good, solid information, but we're not saying you can't work if you don't have a booster.
Well, that's right. I mean, we've relaxed a lot of those rules and restrictions, and I think that's to be expected. People are weary of it, and now we're at the point where we think our job is to give people the information and support them and help them to make well-informed choices. But right now, it really is sort of a matter of everybody understanding their own personal risk situation, but also the risk situation of the people around them. You know,
of their
depending
elderly
on
relatives and
their
neighbors.
family or what
Yeah.
profession they might be in, if they're
Yeah.
caring for people. But we don't have the rules, and I think that's part of our culture. People want to be able to make choices, and they should, as long as they have good information.
Do you feel that President Biden kind of went off script too much when he said the pandemic is really nothing to worry about?
Well, I think what he said is the pandemic is over, and I could hear every public health person around the country
I bet gasping.
Oh, yeah. So, I mean, it was an unfortunate choice of words, I think.
Mm-hmm.
But a lot of people have commented that he was really reflecting where the public is. You know, as far as the public is concerned, it is over.
Mm-hmm.
But I think that's the wrong message to give people.
It did confuse people,
right. The
didn't
message
it?
is it's still with us. We've got the tools to manage it, but we need to use those tools.
So you're saying get your booster. What about masking, Jen?
Yeah, I think for many people, masking, especially indoors in crowded places, makes a lot of sense. If you're someone who has some underlying health issues, or it's been a while since you've been boosted, or you're around people who are very vulnerable, that mask is just another level of protection. And I personally would love it if in the wintertime, when there are lots of viruses running around, if more of us would use masks as a way to just keep the viruses from circulating. We've had very mild flu seasons the last couple of years because of the precautions that people were taking, like masking and avoiding, some of those crowded indoor places, especially when they're sick. And that's another thing I hope that we'll take away from this as a culture. Rather than saying, I'm going to tough it out and go to work when I'm sick, I'm going to stay home with my germs and, and not be
spread them.
Right, not be so cavalier about sharing our germs with our coworkers or families. So there's more we can do to keep each other healthy by using some of those just precautions, hand washing. Simple things like, covering your cough or your sneeze and keeping a distance and not going out when you're sick just make a tremendous difference in keeping the whole community healthier.
What about our kids, our grandchildren, kids in school? Are there things you think the schools should be doing this year that we're not doing that we were doing? Or what's your thought on schools?
Well, it's a great question. And certainly that's been a really difficult thing, is what is the right way to approach the risk to children, the risk to teachers, the role of kids in spreading the virus to other family members. But having them out of school, out of classroom learning, that was a big price to pay, and that we have to acknowledge that. So having kids safely in the classroom is really, really important. And so doing things like, especially if there's an outbreak in the school or in the classroom, paying attention to some of that distancing, putting the masks back on for a little while.
But are the schools even testing as they were?
Well, they certainly have tests available to them. We've distributed a lot of tests to schools to be able to use in the school or send home to the families with the kids. I think we're encouraging people to do that self-testing. Most of us now are using those rapid at-home tests,
Right.
And they're very useful to know when you should stay home.
I have a question.
Air quality is another thing that we're really encouraging, schools and other
To invest in those.
to have air filtration devices. Upgrade your ventilation system.
Is that
helps.
expensive, Jen? Because I know a lot of schools did it, a lot didn't. I was just so curious. Is that a really pricey thing for a school building to
If it's an
take on?
older school, replacing your whole ventilation system can be quite pricey.
I
But
would
that's
think.
why the federal government, some of the COVID money that the federal government sent out to the cities and the states
Could be used
could be
for
used
that.
for that. But also even there, some of these portable air filtration and air purification devices help.
that would be better than nothing,
Yeah,
right?
absolutely. So just paying attention to some of those basic precautions, keeping kids out of class when they're ill.
And the kids can get the
And
new
the kids,
booster, can't
absolutely,
they?
kids can
Right.
get vaccinated down to 6 months now. Now kids down to the age of 5 can get the booster. That just happened recently, and we're expecting that even the smaller kids may be eligible for boosters in another few months after those studies are done.
I have to ask you about long COVID.
Yes.
Because that's the part of the whole thing today that I worry about the most. Because it seems like a huge percentage from what I've read. I read 42%, I believe, of people who get COVID have lingering symptoms. And that's really a serious public health
Yes.
issue, personal issue.
Very much so. Yep.
Do you believe that statistic?
I absolutely do. We're just beginning to understand the full scope of the post-COVID or long COVID challenges, but I have friends, I have colleagues whose health has been severely compromised, who can't work anymore because of the lingering effects of COVID. And it happens even to folks who've had mild cases.
Yes, that's what is really interesting. I think people don't really hear that or know that or want to believe it.
Right. There too, the studies are still happening, but it does appear that vaccination reduces the risks of long COVID as well, or shortens the duration or
Of the
or
lingering.
mitigates the severity of the symptoms.
I mean, that's huge right there, isn't it? In
Yeah.
terms of why go get a booster.
Yeah, I think people should, not minimize that. Since the beginning, we've talked about, well, this isn't really that bad. For most people, it's no worse than a flu. Well, for a lot of people, it's much more serious, and certainly, the number of people we've had in the hospital, the number of people we've lost to COVID is multiples of what happens even in a bad flu year. So it is a serious illness, but even again, for less serious illness, there can be lingering effects. So avoiding getting it
Yeah, that's
and using all the protection you can just makes a lot of sense.
yeah, that's huge. And we maybe need to get more information out on that, don't you think?
Absolutely. And you talked before about how fatigued the public is of hearing about COVID, worrying about COVID. But I think we do need to continue to understand that it's still with us. It's going to be with us. It's changing. We have to kind of keep up with the evolving information. And again, manage our own risk, but also be aware of the effects of our choices on other people.
Be a good neighbor.
Be a good neighbor.
Yeah.
Kind of just comes down to that.
Yeah, doesn't it? Globally, I've heard there are some new variants in Africa. Is there anything in particular that scares you when you hear about these?
Well, part of what we've been talking about is just how unprecedented the size of this pandemic is all around the world. This has never happened before, that we've had pretty much the entire world affected by something at the same time. Millions and millions of cases every day, which gives the virus a chance to evolve and mutate. And it's doing that with incredible frequency and rapidity. So there are more variants and subvariants happening every week than people can keep track of.
Yes.
And for the most part, the information sharing across the world is really good. There are a few variants now that have some similarities, and they have the potential to be better at getting around the defenses of prior illness or the vaccine. So that is always a worry, that what's happening, and that's what we've seen with this pandemic. What happens anywhere in the world can be here fairly soon. So we're very vigilant. It's one of the things we're tracking at the State Health Department with our partners around the state, is looking for these variants. So when they are here in small numbers so far.
So keeping an eye on those, though.
Yep.
Well, we're almost out of time. A few seconds left, Jen. Thank you so much for all you've done to keep us informed these years. And I think I speak for a huge percentage of the Minnesota population we so appreciate, because information is power, right? And where do we tell people to go if they want to get the latest up-to-date recommendations?
Yeah. I always encourage people to talk to people they trust. The information, we've worked hard on our Minnesota Department of Health website to make the information very easy to access. Places like the National Institutes of Health, the Centers for Disease Control and Prevention. But talk to your own doctor if you have questions. It's totally logical to have questions about the vaccines or about the illness or about your risks. But there's a lot of information out there that isn't really scientifically credible. But things spread in this day of social media really quickly, really easily. It's hard to fact check everything.
It is.
So finding people that you trust and listening to them is the best thing you can do.
And the website for
the Minnesota Department of Health
is?
It's health.state.mn.
Okay, that's easy.
And it's very easy, and it's easy to navigate. We've got lots of different COVID resources on that website, and ways to help you find testing or vaccination or treatments, as well as just the information about what's happening in our state and elsewhere.
Well, thank you again. And check out that website and talk to your doctor. Think about what Jan's been saying about, let's think about our neighbors. And take care of yourself.
Everybody be well. Yeah.
Right.
Thank you, Mary.
Well. You're welcome. Thank you. I'll see you again next week. Until then, have a good week.